Many thanks for joining us. This is Qtv News and I am Ajibintu Drame. First, the main local, international and sport news headlines. As Tobaski approaches, we find out why the predicted drop in the numbers of ram for sale has not happened. Today is World Hepatitis Day and we hear what it means for Gambia and the rest of the world. The head of the army visits the press union's headquarters seeking to strengthen ties. A scheme to launch to empower single mothers and help them gain independence. In international news, we investigate the truth about a coronavirus care video that has gone viral in a matter of days. In sport news, Kenya bids farewell to one of its legendary runners who passed away this week. And after 10 years working on the continent, a much-traveled Belgian football coach has probably had his last job in Africa following a racist outburst by him. Those were the main news headlines, and now the news in detail. In local news, as of last Monday, the Gambia Livestock Marketing Agency had registered over 92,000 rams in various selling points across the country. The agency assures the public about the availability of affordable rams in the country. The Minister of Agriculture, together with her ministry officials, visited the Abuko Livestock Showroom, where ram sales also stage.
The biggest Muslim festival, Eid al-Adha, is drawing close. It is the Muslim feast of sacrifice, and the buying and selling of rams and other prescribed livestock has commenced. The Gambia Livestock Marketing Agency is mandated to promote the marketing of livestock. The agency has organized an annual event called the Tobaski Ram Sale at the Abuko Livestock Showground and over 15 other locations designated as ram selling points within KMC, BCC and the West Coast region. The Gambia Livestock Agency has announced that they have registered a record of over 92,000 rams in its selling points around the country at affordable prices, ranging from 5,500 to 15,000 per ram. This figure is more than last year's, which was 48,750. To examine sale prices at Abuko Livestock Showground, I asked for the price of a ram, and prices vary at different selling points.
$4,800.
The smallest ram I sell costs $4,800, and I also sell orders for $5,200 as a last price. Just a few weeks ago, there was a fear there would be a ram shortage in the country due to the coronavirus restrictions. Initially, prices were high. However, the president of the National Livestock Owners Association gave an assurance that due to the increase in rams coming into the country, public demand will be met and that prices will be affordable.
If you go around, you can see good rams, 10,000, 9,000, 5,000, 12,000. And people were expecting it maybe at 20,000 or something like that. Though there are two types of rams or sale here, because others, they are well fattening, they are well taken care of. Others, they just have it, the herders bring their animals in bulk. So if you want a ram, even you have 7,000, you can have it in Abuko here. If you have 15,000, you can have. If you want a ram of 20,000, 30,000, you can have. It depending on which type of commodity you want. But once we have more rams available in the country, I think definitely that is good hazard now for the farmers, and I think it's good for the Muslim Ummah in this country so that they can have what they want to have as long as ram are concerned.
The Minister of Agriculture with senior officials of her ministry was at the Abuko Livestock Showroom to meet livestock farmers, during which farmers shared their challenges with the minister. Minister Fabre has promised to take swift action to address their concerns.
We have our private farmers here coming all the way from up country. They rear their own animals. They have their own prices. It's just a matter of negotiating with them because they bought their feed, they rear the animals. So obviously we cannot determine price for them. So if you want to buy, just negotiate with them.
Preparations towards the Muslim festival come with a lot of expenses, and the expectation is that as we experience abnormal circumstances, there will be common and reasonable understanding in all markets around the country. Mohamed Lamin Choi, Qtv News.
The Gambia on Tuesday joined the rest of the world to commemorate World Hepatitis Day under the theme Hepatitis-Free Future, with a strong focus on preventing hepatitis B among mothers and newborns. The day is commemorated each year on 28th July to raise awareness of viral hepatitis, an infection of the liver that causes a range of health problems, including liver cancer. Omar Pijaro tells us more.
The commemoration brings the world together under a single theme to raise awareness of the global burden of viral hepatitis and to influence real change. It is also an opportunity to encourage real political change to jointly facilitate prevention, diagnosis and treatment. Dr. Ramunjai, a specialist in liver diseases and head of the Gambia Hepatitis Intervention Study, gave a pre-recorded brief history of hepatitis in the country, noting that it was very common in Gambian children before the 1980s, but added that since they started introducing immunization at the clinic level to date, only those who were not fortunate to receive the vaccine are the most at risk. She encourages people to go for screening to know their status.
Whilst during the period where we've had 3 deaths from coronavirus, during this same period we've had 15 Gambians, mainly men, 11 of them were men, aged between 30 and 50 years, who have died from liver cancer and end-stage liver disease, which is caused by hepatitis B virus.
In the Gambia, the Ministry of Health has developed a national hepatitis policy and strategic plan for the country with clear vision and goals. The Gambia was the test ground for the introduction of hepatitis B vaccination in routine immunization services. Thus, the need for the government, WHO and other partners to invest in the hepatitis response by investing domestic funding and providing testing and treatment facilities to eliminate hepatitis as a public health problem in the Gambia.
We screened almost 15,000 Gambians, which showed that 1 in 10 of Gambians are affected with this virus.
The total elimination of the viral hepatitis will only be possible if awareness raising is conducted among the population to know the 5 types of viruses responsible for most cases of viral hepatitis and their mode of transmission. Therefore, urgent actions are needed in the Gambia, where nearly 10% of our population is infected with hepatitis B, which is the most common cause of deaths, with 1.3 million lives lost each year.
So what we are saying is our aim is to prevent those cancers that we can prevent and to detect early those cancers that we cannot prevent so that there is a chance of a cure. So what we are looking for is support to actually develop this unit so that it will be a center of excellence for where we can give high quality care to the Gambians.
According to new estimate from the World Health Organization, the proportion of children under 5 years of age chronically infected with hepatitis B has dropped to just under 1% in 2019, down from around 5% in the pre-vaccine era, the period between the 1980s and the early 2000s. The scale-up of the hepatitis B vaccine worldwide over the last 2 decades has been a great public health success story and has contributed to the decrease in HBV infection among children. In 2019, coverage of 3 doses of the hepatitis B vaccine during childhood reached 85% worldwide, up from around 30% in 2000. However, access to the first critical dose within 24 hours of birth remains a challenge. Global coverage of this birth dose is 43%, but this drops to 34% in the WHO Eastern Mediterranean region and only 6% in the WHO African region. An additional way to protect children is to provide pregnant women with antiviral treatment to reduce mother-to-child transmission of HBV. The WHO already recommends routine testing of all pregnant women for HBV as early as possible in their pregnancy. COVID-19 has threatened every aspect of our lives. Amid the COVID-19 pandemic, viral hepatitis continues to claim thousands of lives every day. Thus, the need to ensure that mothers and newborns have access to life-saving services, including hepatitis B vaccinations. The deadly virus is hampering progress in eliminating HBV. The 2030 Agenda for Sustainable Development calls on the international community to combat hepatitis and for inclusive approaches that promote equity and universal health coverage to ensure no one is left behind. Reporting for Qtv News, I am Omar P. Jallo.
The Chief of Defense Staff of the Gambia Armed Forces, Yakuba Drame, on Tuesday paid a courtesy call on the executive of the Gambia Press Union. According to the Army boss, the visit is to cement the already existing cordial relationship between the two institutions. Babukasi reports.
As part of his tour to the military installations across the country, partner institutions and sectors, CDS Drame on Tuesday called on the Gambia Press Union headquarters in what the Army entourage described as fostering a relationship between the media and the country's military. After more than an hour in a closed-door session with the GPU executive, the Army boss described the meeting as a success. He further stated part of the discussion between the two institutions centered on capacity building for both institutions.
And the purpose basically is to extend that hand of fellowship and equally to explore other areas of possible cooperations between the Gambia Armed Forces and, of course, the Gambian Press Union, given what we're going through as an institution. And I was able to assure them, as an institution, we've turned a new page, and we want to move forward. And in moving forward, we want to lean on strategic partners, more so in the context of the Gambian Press Union. Today, we're happy to say the armed forces under my watch, we gave them the assurance that as an institution, we are going to uphold the dictates of the Constitution in the discharge of our mandates as a vibrant defense instrument.
On the issue of access to information, CDS Drame promised that his institution will continue to provide the necessary information for the press as always, but was quick to note that not all information from the security forces are for public consumption.
We may need some expertise training. We have young journalists in our media department. We want to see perhaps where they could also chip in, because we were made to understand they have an institute that is very competent enough to give those kind of training. We want to see how they can perhaps extend that kind of relationship to us. In other areas also is, they also requested perhaps, if we have recruit training going on, they're more than willing to come to share their perspective with young members of the armed forces as to the roles and functions of the press, mostly in the context of free speech. That is a highly welcome development, and I've given them the assurance that we would not hesitate to allow them to come and give lectures.
On his part, the president of the Gambia Press Union, Sirif Bojang Jr., said a lot has happened between the two institutions in the past and there is a need for a reunion.
Things happened in the past, and like the general said, there is the need for a new page. There is the need for us as media fraternity to understand the role of the army in maintaining peace and stability in the country. It is equally important for the army members of security forces, Gambia Armed Forces in particular, to understand the role of journalists and the media, especially in respect to freedom of expression issues. We discussed this with the general and his team, and we are encouraged by the assurances, by areas where we can build mutual friendship in order to get to know each other's role in order to champion the cause of peace, security.
The relationship between journalists and the security sector have not always been cordial, particularly during the regime of ex-President Jammeh, who saw the press as the enemy and many were incarcerated, disappeared or exiled. With this visit, there is renewed hope between the two sectors and more security agencies are expected to follow suit. Babu Karsi, QTV News.
Single Mothers Scheme, SMS, is an association aiming to reduce poverty amongst women, especially single mothers, and to help them to build their self-esteem, independence and confidence. And they also provide them with a variety of skills to sustain themselves. Loli M. Kamara has more.
Single Mothers Scheme was funded in April 2020 with aims of helping single mothers in Gambia to improve their life skills and also to obtain employment. The founders of the scheme said these women are faced with problems of poverty, low esteem, lack of confidence, isolation and depression, among other issues to deal with. At the launch, Fatoumata Jammeh, the founder of SMS, said the aim is to identify vulnerable women and involve them in self-development and employment so they can earn a decent living through healthy life skills and become economically self-reliant.
The basic purpose of the Single Mother Scheme is a self-help agency which provides an opportunity for human dignity by providing decent housing, food, clothing, health assistance, counseling, referrals, education, and job placement. The establishment of single mother scheme is to seek solution to the social and economical problems related to poverty. It is through joint efforts with relevant stakeholders that we can broaden our outreach to reach out to every single mother across the country.
She went on to say that looking at divorce and death rates, teenage pregnancy and migration are all factors that are cause for alarm.
We are very worried. So therefore, we came up with an association to help these single mothers, help themselves, help us, and help the children out there. I therefore urge everyone to join us, support every woman or girl out there, especially single mothers.
Jatu, a beneficiary of the scheme, shares her experience.
Make plans and set goals. You are coming in the program. Make sure you have a goal and say, okay, I want to learn how to make slippers before the end of the day. You have to challenge yourself and make sure you make that slippers before the end of the day. Have a role model. Always have someone that you will look up to. I have a lot of mentors, and people do complain. Some people do complain that, Jet, you have a lot of mentors. I said yes, because I know what I'm looking for. And I'm still looking for more mentors. Right now, I have more than 20 mentors, and I'm looking forward to have even more. Be self-confident, and also be self-independent. Don't depend on anybody. Depend on yourself and help your children. And the last one is get a skill, which is the most important one right here.
Fatima Bob, a single mother, spoke on behalf of the single mothers.
As a section to the women of the Gambia, to add value to our experiences, challenges, and most importantly, a place where we can give our encounter complaints and request for equal responsibilities or mother-father team to raise our kids in the most conducive and safeguard atmosphere.
The single mother scheme call on others to be a part of the scheme so as to increase and empower more single mothers to contribute positively to the society they live in. Lolly M. Camara for QTV News.
We will go for a short commercial break, and when we come back, the news continues with international news. And we hear two stories from the world of sports. Stay tuned. Welcome back, and if you are just joining us, this is QTV News. We start with an international news story about a video which is causing quite a stir. Facebook, Twitter and YouTube have all removed a video featuring a group of people wearing white lab coats who call themselves American frontline doctors who staged a press conference in front of the U.S. Supreme Court building, making false claims that coronavirus has a cure. QTV's Mobdulamin Choi has been following the development, and he now reports.
It takes less than a day for the misinformation video on the novel coronavirus to go viral, hitting millions of views on Facebook, Twitter and YouTube after a group of people calling themselves America's frontline doctors staged a press conference outside the U.S. Supreme Court and are seen without face masks and without physically distancing among themselves. Their false claim is that hydroxychloroquine, zinc and Zithromax can cure COVID-19. One of them, since identified as Dr. Stella Emanuel, does most of the talking and claims that she has cured 350 patients with COVID-19 using the drug. Breitbart News, a right-wing, Trump-supporting media outlet, had published the video. President Trump, who casually made similar claims in March and early April, weighed in by sharing multiple versions of the video with his 84 million Twitter followers. Underlining tough stance in policing COVID-19 misleading posts, Twitter, Facebook and YouTube have deleted the video, labeling it as a violation of their COVID-19 misinformation policy. America's self-styled frontline doctors is led by Dr. Simon Gold, a Los Angeles-based emergency medicine specialist who upholds that stay-at-home orders are harmful. Gold told the Associated Press in May that she wanted to speak out against stay-at-home orders because there was no scientific basis that the average American should be concerned about COVID-19. Almost all the claims by the American frontline doctors are contrary to what global health experts have advised as effective preventive measures against COVID-19. A new study by the World Health Organization shows that social distancing, face masks wearing, and eye protection all reduce the spread of COVID-19 in both healthcare settings and the general public. There is no scientific evidence which has proven that hydroxychloroquine is a cure for COVID-19. A recovery trial was run by Oxford University, one of the world's largest studies involving 11,000 patients with coronavirus in hospitals across the UK, and included testing hydroxychloroquine's effectiveness against the disease, along with other potential treatment. It concluded that there is no beneficial effect of the drug in patients hospitalized with COVID-19. The World Health Organization has halted its trials, saying that the drug does not reduce death rates in patients with coronavirus. There is still the search for a solution to COVID-19. Already there are 23 coronavirus vaccines in clinical trials around the world. The world has now registered over 16 million confirmed COVID-19 cases, over 9 million recoveries, and 655,000 deaths. Mahmoud Lamin Choi, Qtv News.
And now here is the sport news. Ben Gypsum, one of the legendary group of athletes who helped put Kenyan middle and long distance running on the map, has died. This story by Alhaji Ahmad Cham is narrated by Ade Rami.
President Uhuru Kenyatta sent a message of condolence to Gypsum's friends and family, describing him as a national hero and a pioneer athlete who helped cement Kenya's profile on the international stage. The head of state wished the family of the highly decorated Kenyan athlete God's comfort and peace as they mourn their departed patriarch. The athletics fraternity in the country has been thrown into mourning following the death of the 1972 Munich Olympics 3,000-meter steeplechase medalist. The 77-year-old legendary athlete passed away on Friday morning at an Eldoret hospital. Gypsum was a humble, courageous and tireless star who won silver medals in the 3,000-meter steeplechase and the 1970 Edinburgh Commonwealth Games and the 3,000-meter steeplechase at the 1972 Munich Olympic Games. Our sincere condolences to his friends and the athletics family. Rest in peace, he said. Sports Cabinet Secretary Amina Mohammed said Kenya had lost a formidable sportsman whose unrelenting pursuit of athletic excellence inspires Kenya's generation of the greatest athletes on earth. She said the ministry will support his family to offset the hospital bill and funeral expenses through the Veterans Support Scheme. It is with profound sadness that I've learned of the passing of the legendary athlete Ben Gypsum this morning. Hero Gypsum will be celebrated as one of the most accomplished athletes whose experience put Kenya on the global sporting map as early as 1968 at the Mexico City Olympic Games, she said. We celebrate Gypsum now and in the years to come. In August last year, Kenya lost another Olympic champion, Robert Uko, who died at his home in Ngong. According to his fellow former track athlete Rose Tata Muya, Uko died while chasing money from the government meant for heroes and heroines to help them when they are alive. It may be that Uko's story is what has prompted swifter action in the offer to help Gypsum's family this time. Reporting for QTV News, Ade Darami.
Luc Emael, a Belgian football coach with a long, varied and successful career in many African countries, has seen his African adventure come to an end after an extraordinary racist outburst by him. This story by Alhaji Ahmad Cham is narrated by Ade Drame.
He has coached for 10 years on the African continent, and look, Emael has worked in 11 different countries in Africa and for a few months in Tanzania as head coach of Yanga Young Africans, one of the two biggest clubs in that country. The adventure has come to an abrupt end for the Belgian, who was sacked by his employer after making scandalous and racist remarks during a press conference. For a man who has spent so much time in Africa, his comments were pretty shocking. Here's what he said. "I don't feel good in your country. You are poorly educated people. I am disgusted. I have no home, no Wi-Fi, no satellite TV. These fans don't know anything about football. When they cry, they look like monkeys and dogs," said the 60-year-old coach. Needless to say, the comments aroused indignation, and his dismissal came with his club sitting in second place in the standings. As with many European coaches employed in Africa, Emael had a mediocre playing career and no coaching experience of note in Europe. Nonetheless, his African sojourn has seen him coach many big clubs and achieve a lot of success. Emael's first coaching job took him to DR Congo, after which he went on to coach in Rwanda, Gabon, Algeria, Kenya, South Africa, where he coached various teams over 3 or 4 stints. Then on to Tunisia, Oman, Sudan, Egypt, and finally Yanga Young Stars in Tanzania. Perhaps the Tanzanians should have seen it coming. In 2018, while coaching in South Africa, the newspapers frequently spoke of his arrogance and lack of grace, even when winning. Suffice to say, it appears that Emael's African adventure is almost certainly over. Reporting for QTV News, Ade Darame.
Before we end this bulletin, let's take a quick look at our main stories. As Tobaski approaches, we got to find out why the predicted drop in the numbers of rams for sale has not happened. Today is World Hepatitis Day, and we heard what it meant for Gambia and the rest of the world and how the day is commemorated here. The head of the army visited the press union's headquarters, seeking to strengthen ties between the two sectors. A scheme is launched to empower single mothers and help them become independent. In international news, we investigate the truth about a coronavirus care video that has gone viral in a matter of days. In sport news, Kenyan bade farewell to one of its legendary runners who passed away this week. And after 10 years working on the continent, a much-traveled Belgian football coach has probably had his last job in Africa, following a racist outburst by him. That's all we have for you in this bulletin. Thanks for watching and join us tomorrow for another bulletin. Stay tuned.